I'm Lisa Reidsema with Craft Your Practice, and this is episode 7, Choosing a Specialty. This is a topic that causes a lot of anxiety for new therapists and even for experienced ones who are pivoting. The question sounds simple: what do you specialize in? But for a lot of people, the answer feels impossible. You might feel like you're not an expert enough in anything, or you might be interested in everything and worried that choosing one thing means losing everything else. Today, I want to take the pressure off this decision and give you a practical way to think about it. Because choosing a specialty is not about narrowing yourself into a box. It's about making it easier for the right people to find you. Specialty is not a permanent identity, it's a positioning decision. It is the answer to the question, what do I want to be known for right now? Your specialty can change over time. It should change over time because you will grow, your interests will shift, and the field will evolve. The therapist that you are at year 2 is not the same therapist you will be at year 10. That is a good thing. But right now, especially if you're building a practice, you need clarity, not because you're locking yourself in, but because vague positioning makes you invisible. If your website says you treat anxiety, depression, trauma, grief, couples, teens, life transitions, self esteem, you sound like every other therapist on Psychology Today. And when you sound like everyone, no one remembers you. The difference between a specialty and a niche. People use these words interchangeably, but they are different. A specialty is what you treat or what modality you use. For example, trauma, eating disorders, EMDR, perinatal, mental health, OCD. It is a clinical focus. A niche is who you serve. For example, first generation college students with anxiety, high achieving women in burnout, and then navigating divorce. A niche combines the clinical issue with a specific population. You do not need both on one day, but having at least a specialty, a clinical focus, gives you something to build around. The niche can sharpen over time as you learn who keeps showing up in your office. How to choose. Here's a framework I use when I help therapists think through this specific question. It is not a quiz, it's a set of honest questions. First, what do you already know? Look at your training, your practicum, your internship, your first jobs. What populations did you work with? What issues came up most? You have more experience than you think. And that experience is the seed of your specialty. Second, what do you actually enjoy? Not what you're supposed to enjoy, not what looks good on paper, but what kind of sessions leave you feeling energized instead of drained. If you dread couples work, do not specialize in couples just because it's lucrative. You'll burn out. Third, what does your community need? This is practical. If you live in an area with 10 trauma therapists and 0 eating disorder specialists, that's useful information. If you're in a rural area and you are the only therapist within an hour, your specialty might be broader by necessity. Context matters. And fourth, what are you willing to invest in? Specialties often require additional training, certifications, consultation groups, advanced coursework. Are you excited about that investment, or does it feel like a chore? If learning more about a topic feels exciting, that's a signal. The fear of choosing. I want to address the fear directly because I hear it constantly. Therapists tell me if I choose a specialty, I will lose clients who do not fit. And that is true. You will. That's the point, because the clients you lose are the ones who were never a good fit to begin with. And the ones who find you because your language is clear and your positioning is specific are the ones who can actually be helped by you. Choosing a specialty does not mean you refuse to see anyone outside of it. It means you lead with what you do best. You can still take a grief client if that feels right, but your marketing, your language, your referral network, those are all built around your specialty. That is what gives you traction. What if you are generally interested in everything? This is real and it's valid. Some therapists are generalists by nature. If that's you, here's what I would suggest. Pick the thing that is most marketable right now and build your practice around it. That does not mean it's the only thing that you do. It just means that it's the thing that gets people through the door. Once your caseload is stable and your referrals are flowing, you can expand, you can add groups, workshops, or a secondary focus. But trying to market yourself as everything from day one is like trying to be heard in a crowded room by whispering in every direction. Pick a direction, speak clearly. You can always pivot later. When your specialty chooses you, I want to mention one more thing because it happens more often than people realize. Sometimes your specialty just chooses you. You put yourself out there with a general focus over time. You notice a pattern. The same kind of client keeps finding you. The same issue keeps coming up, and you realize you are drawn to a particular population or presenting problem, not because you planned it, but because the work resonated. Pay attention to that. Your practice will tell you who you are meant to help if you listen. Common myths about specialties. There are a few myths floating around that I want to address because they hold people back. Myth number one: you need a certification to claim a specialty. You do not. Certifications are valuable, and I encourage additional training, but you can specialize based on experience, focused practice, and ongoing consultation. If you have worked with trauma for 5 years in an agency setting, you can absolutely call yourself a trauma therapist without an EMDR certification. The certification adds credibility, but it is not a prerequisite for specializing. Number two, a specialty limits your income. This is the opposite of the truth. Specialists typically charge higher fees, get more referrals, and fill their caseloads faster than generalists. When you're known for something specific, people seek you out. Generalists compete on availability, specialists compete on expertise. Myth number three, you have to pick your specialty before you start your practice. You do not. You can start with a broad focus, pay attention to what shows up, and narrow over time. Many successful therapists found their specialty in the first 1 to 2 years of practice. Not myth four. Once you pick a specialty, you're stuck with it forever. Absolutely not. Your specialty is a positioning decision, not a life sentence. You can shift, expand, or completely change direction as your career evolves. Some of the best therapists I know have reinvented their specialty 2 or 3 times. How to test a specialty. If you are not sure whether a specialty is right for you, here's how to test it without fully committing. Start talking about it. Update your Psychology Today profile to emphasize that focus. Write a blog post or social media content about it and see what happens. Do you get inquiries from that population? Do the conversations feel natural? Do the sessions feel like work that you want to keep doing? Take on the 3 to 5 clients in that area intentionally, not as a formal research project, but as a real world test. After a month or two, check in with yourself. Are you energized? Are you curious? Or are you bored and counting the minutes? Talk to therapists who specialize in that area. Ask them what they love about it and what they find draining. Get an honest picture before you invest in expensive certifications or rebrand your entire practice. The goal is not to agonize over the perfect choice. The goal is to try something, learn from it, and adjust. Here's the bottom line. Choosing a specialty is not a life sentence. It's a starting point. It's what makes you findable, referable, and credible. Start with that. You know what you enjoy, what your community needs, and what you're willing to invest in. Pick something, say it clearly, and let the work teach you the rest. If you want more help with this, check out my ebook, Therapy Specialties, and you can find it on craftyourpractice.com/books. And The link is in the description also. Thanks for watching, and I'll see you next week. Take care.